oh, I should also include this. Okay, anyways, it's fine. Aside from doing the life coaching, the therapy, I also had a physical therapist that, shout out to my midwife, recommended right after my son. So after my first kid, my midwife, they do their full body assessment on you. And I had to do this, you have to do like a sit up, right? And you're like, oh my God, you make me do a sit up, right at the 6-week appointment. And so I do the sit up barely, right? And they feel they're feeling your abdominal wall. That's what they're feeling for, right? And she was like, okay, you have less than an inch of gaping. So if you're not familiar already, your abdominal muscles, right? Like once you have a kid, when you're pregnant, the abdominal muscles, they go to the side so that your belly can expand, so baby can grow nice and healthily, right? So, but then after the baby is out of you, ideally, the abdominal muscles will just come right back, right? That's where, and I don't like to use this phrase, but that's where snap back, in my head, where I feel like it would come from, because, you literally just kind of snap back in a way, and everybody's snap back looks different, but, with that being said, so it's supposed to come back together, right? Your abdominal wall is supposed to come back together so that all your organs and all of that stuff, your stomach's in there, your pancreas, it's wild when you think about it, when you become pregnant, how all those organs and everything just goes to the side, right? But after baby comes out, they all have to come back, and hence the abdominal muscles have to come back like this, so then they can house everything properly. So at the 6-week appointment, that was what my provider was looking for, was to make sure that my abdominal muscles were coming back as they should, right? And there are women that it doesn't, and so what I'm talking about is diastasis recti, right? So if you're not familiar with that already, I encourage you to look that up if you are a postpartum mom that you're well, how do I say this? You'll notice that, you have your belly is just protruding, and it wasn't like that, or it's worsened after the baby. And, this is not immediate. I would say you notice this maybe months after, right? You need to make sure you're you following up with your provider though too, to have these conversations. But what that is called when your belly is just hanging out, if you will, is postpartum wise, is diastasis recti, right? So with that being said, there are exercises that you can do that we're going to do today. That is my long-winded way of saying that there are exercises that you can do for diastasis recti if it's not too far gone. So that's the thing. So rewind again back with my story. I do the sit-up at my 6-week appointment. And she's like, okay, it's not that bad. I think it was less than an inch that I had gaping. But again, my provider, she was like, but I'm still going to write you that physical therapy referral so that you can, get physical therapy postpartum. And I said, what? Because yes, I am a nurse, but I had never, when I think of therapy with my nurse hat on, I think of physical therapy for somebody that's had a stroke or somebody that's been in a car accident, but for somebody that has had a baby. And isn't that a shame? I'm going to say that. Isn't that a shame, right? So I remember looking at her and I was like, physical therapy, really? And she was like, yeah, giving birth is and I know there is a corner of the internet that's why do we have to say that it's a traumatic experience? For a lot of women, giving birth is a traumatic experience. I hope, that wasn't for you, but for a lot of women it is. And so she was like, giving birth is a very traumatic experience. And just the same way that if somebody got into a car accident and God forbid, a semi rams into your car, into you, you're going to have to get fixed up, right? So the same way that whichever way you birth the child, you have to get fixed up. You have to rehabilitate your body, right? And you have to be patient though with your body, because I remember, oh my gosh, like certain things in life, I don't be remembering everything, but there's certain moments in life, specifically since being a mom, becoming a mother, I remember where I was in my house. Like, isn't that wild? But I remember like where I was in my house and I'm trying to do these crunches or the bird dogs. Like, we're going to do the bird dogs and we're also going to do this other thing. Not crunches, just bird dog and the other thing. I forgot the other thing is called, but we're going to do it. And I remember feeling so weak. And I remember like I was talking